Welcome back to the Morning Blend. There's a new online resource for breast cancer patients that's helping them become experts in their own illness. The goal is to empower them to make good treatment decisions. It is the first one-stop site developed by a doctor to help patients learn as little or as much as they want. Dr. John Williams is the creator of Breast Cancer School for Patients. He's a leader in breast cancer patient education and an advocate for their involvement too. Good morning to you, doctor.
Thank you for having me, Molly. It's a pleasure to be here.
We appreciate your time. And here's the thing. If you're diagnosed with breast cancer or any cancer or maybe any illness for that matter, for most people, as soon as they get home, the first thing they're going to go to is their computer and they're going to look up some information. Some of it's good, some of it's bad. Where does this site fit in?
Well, Molly, information online, there just seems to be something missing about healthcare information online. Like you said, it's scattered. There can be real details, but ultimately, you need to learn the concepts that you're going to confront, whether you have breast cancer or whether you're just trying to make a decision about your own breast health. And that's why we created the Breast Cancer School for Patients, all video format, teaching you the concepts you need to know.
And I want to talk about some of those topics or concepts in just a minute, but first talk a little bit about how long this took you to put together. And did you draw a lot of information from your own time with your patients?
It took 3 years. I thought I was going to write a book about how to get better quality breast cancer care. And then I ended up learning, as we were talking about, the information online is missing something. So why not put all of this information in video format and teach everyone the different topics, which you will cover in a moment. But it empowers you. It brings into your home almost like personalized telemedicine.
And I think that part of it is different. You talked about telemedicine, which is a word I'd never heard before, but that idea that the website is interactive and developed specifically by a doctor who treats breast cancer. So in terms of those topics, I was very interested in the concept that you can learn as little or as much as you want. And you cover difficult topics like, will I survive breast cancer? What's a surgery consult like? What can I expect? What about genetic testing? Where can I find the best doctors to get treatment? And then information also about trial studies.
Every one of those topics are key topics, but no one presents it to you in that fashion. Will I survive breast cancer? Well, patients ask me, am I going to die of this when I'm treating them with a newly diagnosed breast cancer? So why are we as healthcare physicians afraid to confront the serious topics with patients? Because it's really the information they need to know. So we've created a new paradigm in synthesizing all this information, and we actually teach it. It's free, it's available, it's my passion, and it's not for profit, it's not monetized. It's available for everyone. Why are we not teaching women exactly what they need to know? And that's the whole concept behind the Breast Cancer School for Patients.
Now, I know you have a series of all different videos covering some of the topics that we just talked about. Is it also interactive? Do you take questions?
You can reach out and contact us and give us feedback. And also, if you register, we will immediately send you a list of several hundred questions that cover every topic if you're diagnosed with breast cancer. There's not so much of a give and take in this fashion because it just gets very difficult to monitor that. But we're just getting up and running, and we think it's a leap forward in healthcare information, and most importantly for women who are worried they may get breast cancer and those that are recently diagnosed with breast cancer.
I want to ask you, doctor, is there any age group currently that's experiencing a higher rate of breast cancer diagnosis than others, and why do you think that is?
Well, that's a wonderful question. Interestingly, when you get older, the chance of you getting breast cancer increases. So if you're in your 70s, the chance of you getting breast cancer this year is a lot more than if you're in your 30s. But the breast cancers you get when you're in 70 are less threatening in general. What's interesting about younger women, we're starting to see and talk more about younger women getting breast cancer. And you can only imagine the emotional and life-changing and life-altering diagnosis that would be if you're 30 and you're just starting your life. And so we need to keep an eye out for everyone, and young women and older women need to know about breast screening and whether they're at risk, and also make sure they take control of their own breast health.
I think this is a wonderful resource for people, Doctor. Thank you so much. And quickly, where can people find the Breast Cancer School?
Visit our website at breastcancercourse.org, and you can learn everything that you need to know to get the best quality care in your community.
And it's free, breastcancercourse.org. Thank you so much, Doctor, for your time.
Thank you for having me, Molly.
Absolutely.